Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio, and I'm real glad that you could join us again. Going to be speaking with Dr. Kendra Grubb. She's joining us here from the Emory Structural Heart and Valve Center in Atlanta, and she's going to talk about some data from the national survey released by patient advocacy group heartvalvesurgery.com and supported by Medtronic. Welcome to Health Professional Radio, Dr. Kendra Grubb.
Thanks for having me, Neil.
Well, I did, of course, mention that you're here from Emory Structural Heart and Valve Center there in Atlanta, Georgia. Give us a bit of your background, and let's talk about this survey.
Sure. Well, I am an adult cardiac surgeon and also trained in the transcatheter therapies to address valvular heart disease. So when a patient comes with a problem with one of their heart valves, I and my team assess them, and we discuss them in a heart team approach about what the right options are. And I feel very lucky in that I get to do both. If the patient needs open heart surgery, I can go in and replace or repair their valve the traditional way using, open heart surgery techniques. Or I also am trained in the new technologies where we're able to use catheters and wires and use the patient's anatomy to replace their valve using long catheters and wires to access the heart, usually from the groin. That procedure, for example, is called TAVR, T-A-V-R, or transcatheter aortic valve replacement. So that's my background. I'm the surgical director of the Structural Heart and Valve Center at Emory, and it's really exciting to be part of this work. In regard to the survey, the new heart valve patient national survey was done as an initiative to assess patients' understanding of their disease process and to help raise awareness. It's an active living awareness initiative, and as you mentioned, it was sponsored by heartvalvesurgery.com. And to put it into perspective, about 5 million Americans live with valvular heart disease, and about 1.5 of those have aortic stenosis. And the problem with aortic stenosis is there's no medicine to make it better, and it just keeps getting worse. And as patients start to feel worse, their risk of dying from their disease starts to go up dramatically. And what we started seeing during COVID was that patients were reluctant to come to the hospital for the fear of being exposed. They figured that they were safer at home. Well, for patients with severe aortic stenosis, them having shortness of breath, which represents heart failure, is far riskier than them, potentially being exposed to a COVID patient. And so there was a lot of education that needed to happen. And ultimately, the results of the survey were in an effort to empower patients to be proactive in their care. And it's really exciting that they looked at about 3,400 patients to try to get real-world insight into what patients were thinking, what drove them to go seek treatment, and then how they felt afterwards.
Did you find that more patients wanted to understand their condition overall because of the fear of COVID-19? Was that something that prompted some patients to want to learn more? Because I guess they were living a certain lifestyle before the pandemic, and all of a sudden everything is complicated.
Well, I'm not sure we asked that question directly, but I think that the sentiment behind some of the questions that we're asking, the answers are exactly what you're alluding to. It turns out that 90% of patients reported being influenced influenced in terms of they felt most strongly that their discussion with their doctor was the most important thing. And with so much information out there online, I was surprised that number was so high. You can go online and get all kinds of information about aortic stenosis and the symptoms and the treatment options. But 90% of patients really felt that discussion with their doctor was a key element to them seeking treatment. And so I do think that, we had an important breakthrough there, that conversation with the doctor, that getting information from an expert, the ability to interact with a heart team and be told you have these options. You can do nothing. You can have open heart surgery. You can have a transcatheter aortic valve replacement. And with each of those paths, this is what you can expect. I think that's really empowering. And so during that time, we did a tremendous amount of telemedicine. We followed a list of patients who we tried to kind of triage into the acute needs to be treated now, and then the patients who could wait a little while, and then patients who we felt we could follow for maybe even up to 6 months, and that they would be okay. But it did require us to continue to touch base with these patients. Interesting, one of the other findings was that many of the patients wished that they had sought treatment earlier. They, especially those who were treated, they recognized that they lost time, that if they had gotten treatment earlier, they had the opportunity to feel better sooner, get their life back sooner. And I think that's really, this active living idea. Many of our patients are octogenarians, and at 80 years old, you just think you're slowing down. But if I can make you feel better by fixing your valve, the sooner we do that, the better. And that was really something that this survey brought to light.
So was that one of the key findings, that people thought that they were just slowing down rather than a serious heart event taking place? Was that the big factor in not seeking treatment earlier?
No, the not seeking treatment is multifactorial, but that's what I hear, in my clinics. When I see patients, especially when a patient is 80 years old, they think they're just getting older. But the reality is even at 80, what you could do 6 months ago, you should still be able to do today. You shouldn't be noticing that much change. So if you could go out and walk the dog a mile a year ago, you shouldn't now only be able to walk a few blocks. And so some of it is recognition and some of it is education. There are many patients that never are sent even to have the discussion about their valvular heart disease. And so although this survey was focused on the awareness at the patient level, there is also a tremendous need for awareness at the primary care physician level and the referring cardiologist level. For our heart team, it's just a conversation. It doesn't mean you're going to have surgery. It's just the beginning of us telling you the information so you can make a decision about what you want done with your body. And for patients with aortic stenosis, they estimate that only about 40 or 50% of the patients with the disease are actually ever sent for treatment. So there's a tremendous knowledge gap there where patients are at home. Oh, I'm just slowing down. They see their primary care doctor or their cardiologist. They're diagnosed with a murmur. And then nobody ever follows that up to say, this is a treatable problem. A murmur is just a sound. It's the swishing sound that it makes as the blood goes through the tight valve. Then it's not normal. And we need to figure out why. And so there's empowering patients to say, well, why do I have a murmur? And should I go and talk to somebody else? That's what the hope is with this survey, that we start educating patients to have the knowledge to say, well, I need more information. And then come to a heart team where you're going to be seen by a cardiac surgeon and an interventional cardiologist and a whole team of people who are going to try to come up with a solution that's best for you. And of course, the patient is the critical decision maker in that. What do you want done with your body and what your expectations are?
So where can our listeners get some more information about this initiative online?
So there, as mentioned, the heartvalvesurvey.com is one place to be able to get the results. Heartvalvesurgery.com, and that has all of the results. And certainly, if you just Google new heart valve patient national survey, it'll take you to a whole bunch of different links. But the heartvalvesurgery.com shows pictures of what the valve looks like, what aortic stenosis looks like, what the treatment options are, and goes through all of the data. So it's really powerful for patients to be armed with knowledge.
Well, I appreciate you joining us here on Health Professional Radio, Dr. Grubb.
You're welcome.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Kendra Grubb. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.